Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. My tip for today is, what do you do if setbacks happen when your loved one is in ICU? So to give you an example, I'm working with a client at the moment, and the client had their loved one or has their loved one in intensive care, and they got extubated a couple of days ago, which means they had the breathing tube removed and the ventilator removed. Now within 24 hours of extubation they got re-intubated because they couldn't cope breathing by themselves. So then the intensive care team went back to the client and said, look, your mum won't survive, and they started the negativity all over again and started the doom and gloom again. So what do you do in a situation like that? Number one, you need to read between the lines. What does it all mean? Number two, you need to get the facts right. You need to get the clinical facts. And then when we look at the clinical fact, it often turns out it's just negativity from the intensive care team and often withholding the facts. Now what happens often is, in this situation, the client got re-intubated, and then the next step is probably a tracheostomy and then start the weaning process again. So my tip for today really is, if you're faced with setbacks, get the facts. Talk to a professional like us at Intensive Care Hotline, get the facts, and then we can put things in perspective for you and we can guide you what the next steps are without the negativity and the doom and gloom of the intensive care team. That's my tip for today. Take care, and I'll talk to you in a few days.